My name is Ed. I'm 65 years old. I was in the military. The military always wants people to be ready to go to war, and as a result, if there's a problem that's going to take a long time to fix, they pull the tooth instead. So I didn't have many teeth left when I saw Dr. Metz, and things were breaking down. Before I saw Dr. Metz, I was getting treated very patchwork. Something, I broke a filling or a cavity or even sometimes a cap, and they would fix that one thing. I was in a large dental group, and I felt like I was always being tossed around from specialist to specialist. I was referred to one specialist who they said was just a consultant, and he walked in, looked at my x-rays, didn't say hello, and said, "This is going to cost you a lot of money." And at that point I decided to look elsewhere and got hooked up with Dr. Metz. When I first saw Dr. Metz, he gave, before addressing the problems I came to him for, he gave me a thorough exam, cancer screening, did some minor advice at that time on how I could better maintain my mouth. And then took some films to get more information from me. A couple of days later I saw him again. He came out with, I think it was 3 different treatment plans at that time, and we chose the one that seemed best for us. I was pretty clear on what was going to happen every step of the way. My only anxiety was the amount of time and effort put into this. I just wasn't sure I was up to the task, and Dr. Metz kind of guided me along that way. One of the first things I needed to do was get some periodontal surgery done, and he sent me to a very nice specialist who also put me at ease at that time. I think because of my age more than anything else and the length of the surgery, he had a dental anesthesiologist come in also to administer anesthesia. When he gave me the medicine, I saw them plug in the IV with the medicine bag, and that was all I remember. At the end, he disconnected the bag. The assistant came over and said, "Hey, sir, you're okay to go now." And I literally walked off the table. I wasn't tired or jittery or wobbly or anything like that. I just walked right from the chair out to my car, where my wife took me home. I didn't feel any pain. I felt like I had probably the most restful sleep during the procedure that I ever had. And I was raring to go, and my wife couldn't keep me down, and we went shopping and stuff like that. We even went out to eat. When I got home, Dr. Metz called me up and asked me how I was feeling and whether I had to take any pain medicines, and I said no, I really didn't need any. Well, a couple of weeks after, I think it was about a week or so after the surgery, I came in, we set up a temporary, and about 2 days, temporary, to my surprise, was a full set of teeth. I thought maybe he was just going to give me enough to get me by until the permanents came in. And part of the temporary broke maybe a week later, and I heard a loud crack and the sinking feeling inside of me. I really expected Dr. Metz to say, well, just don't chew on that side anymore and everything else will be okay, because everything else was okay. But yet he made me a whole new temporary set and spent a lot of time that I really didn't expect to do or didn't think I even needed at that point. Before I started the treatment, I basically I had broken my one last articulating teeth on one side of my mouth, so I was always shoving all the food to another side of the mouth, and frankly, even when I had temporaries in, I had to learn how to chew all the way around because I still was shoving food to the all good side. I was impressed that Dr. Metz seemed to take his time a lot with me. Some of our appointments were very long and sometimes quite tedious, where there was nothing for me to do. I get kind of bored, and my iPod ran out a couple times during it, but everything it seemed to go well. Every once in a while something didn't. One time we took an impression and it took out, it removed teeth that were just cemented in, and we had to go back and do them again. And Dr. Metz and his crew was always very professional and very comforting, and I was disappointed I wasn't, I don't like being in the chair for long periods of time, but I was disappointed about that, but it went well, and didn't really have a problem. And I understood everything that was happening or didn't happen or should have happened but didn't happen, and it all worked out well. I was pretty well knowing what I expected when the finals came in and what I would look like, because the temporaries, I thought he did a really good job making the temporaries look pretty good. So I expected that and no more, but I noticed there were better contours on it. One of the the questions I had about the temporary was they actually looked too good and every tooth looked too perfect, so I kind of asked that they mess one up a little bit. I was thinking about taking up smoking just so I could darken a couple teeth, but my wife said no. I really expected to spend a lot of time in the chair after they were placed in, because I was sure that they couldn't fit that perfectly the first time. They fit real good the first time, and maybe I think we spent about 15 more minutes just honing down a couple things and being picky. I was also concerned because the anesthesia was wearing off, and I didn't know whether or not, once the anesthesia wore off, whether I'd find, oh no, it doesn't quite fit right or something like that, and that was not the case. I think we had one minor adjustment at the follow-up visit, and that was it. So I was really quite surprised and pleased about that. The next day, after getting in both sets of permanents, I went out and had some ribs, and didn't have a problem. But I haven't hesitated to try everything. I just can't remember what I haven't tried before. I wish I had met Dr. Metz sooner. I've been out of the military now for 4 years, so it would have been nice to have gotten started on this sooner before everything broke down and I came in as a kind of a basket case, I guess. But I'm glad we did it. I'm glad I have some function back that I didn't even know I was missing before.